I'm so excited to be here, even more excited after hearing that series of inspirational ideas from Kristen. So a question for you all. Why are we even asking how can tech, big tech in particular, thoughtfully support and innovate public health? Sounds to some of us perhaps oxymoronic. But the opportunity is really exciting. You all know that in the last couple of decades, the world has changed dramatically. People are now finding each other and finding information online. And we have an opportunity as public health professionals to meet them where they are. And on platforms like Facebook, we can notice what they're doing organically that might be positive for their health or give us a signal about an opportunity. And we can use our reach and our ability to design engaging experiences to amplify those positive behaviors. Now, even if a company like Facebook weren't interested in seizing that kind of opportunity to have impact, we still have a responsibility. Our platforms can be used for negatively impacting health, and we need to address that to the best of our ability. I'd like to start by sharing with you an example of opportunity. So you may know that in many countries, it is the responsibility of individuals to arrange for their own blood to be donated for a given procedure. And a couple of years ago, some of my colleagues at Facebook noticed that people were using Facebook and WhatsApp to try to find blood for themselves or a loved one. And we wondered, how might we help that work better? And so we built a product, and it has two main parts. First of all, we invite people on Facebook to volunteer to be potentially available to donate blood. And they can indicate, for example, their blood type. And then here's the really important part. We partner. We partner with blood banks to understand their needs, the demand, the workflows, and allow blood banks to let those volunteer donors know when there's a volunteering opportunity near them and in real time, so that they can act on the goodness that many of us have inside of us waiting to come out. And this product was launched about 2 years ago in Brazil, India, Bangladesh, and Pakistan. And millions of people have volunteered to donate blood via this product so far. It was just launched a couple of months ago in the US, and the results are promising so far. Now, when you think about big tech and health, really, what could possibly go wrong? So perhaps the biggest challenge on Facebook is misinformation, the biggest challenge related to health. And in the last couple of years, in the last year or so, we've been putting a lot of effort into trying to address vaccine-related misinformation. This mostly involves working with experts like the WHO and the CDC to better understand, because remember, Facebook is not a health company, to better understand, with the guidance from those experts, what are the debunked myths and the conspiracy theories that we need to be most aware of, and then using our expertise to work to reduce the spread of that information and the corresponding potential harm. So while most of our work, and in the last, actually, as we speak, in these just last couple of weeks, we've been running that same playbook and evolving it in collaboration with the WHO to address some of the emerging myths and challenges related to misinformation about coronavirus. And you'll be seeing both in this country and around the world tools like that rolling out. Some have rolled out already, and others in the coming days and weeks. So most of our efforts have focused on defense, on combating misinformation. But more recently, we've begun to experiment with proactively showing accurate information from authoritative sources. So for example, there on one side of the screen, you can see that when someone searches on Instagram for hashtag vaccines, they now, before seeing the otherwise organic results of their search, are getting a pointer to the WHO, or perhaps a more locally relevant organization, depending on where they are. They can review that or proceed to the organic results, but they're given an opportunity up front. And that's a new effort for Facebook. We're very much learning how that works for us, trying to measure its impact. And another recent effort, this one focused in the US, is an interactive version of a preventative health intervention, where given your age and gender, if you want to provide it, you can get information related to vaccine recommendations, cancer screenings, and cardiovascular screenings recommended by folks like the CDC and the American Heart Association. And this is a good opportunity to talk about one of our other huge responsibilities, and that is looking after privacy. So when we build tools like this new preventive health tool, or the blood donations tool that launched in the last couple of years, we've built them from the ground up with the idea that the context in which this tool was going to be used was health related. That allowed us to think proactively about what our advertising policies are, how to most thoughtfully manage the data. Take as a counterexample Facebook groups, which is near and dear to my heart, which I'll explain why in a moment. That Facebook groups was launched now over 10 years ago, long before Facebook had any intentions of contributing to people's health and being a platform for health information seeking. So I'm going to pause for a second to share with you a little bit about my own journey. My professional career started as a primary care physician, and I was working in both primary care and urgent care. I grew up around Silicon Valley, and I had a sense of the meaning and the power of technology as it was emerging. But when I walked into medical school, I noticed that we were probably a couple of decades behind in health, public health, medicine, with regards to leveraging the power of these new technologies. So I ended up developing a dual career and really wanted to understand how patients were using or could use technologies to improve their health. I spent several years working at Google studying how people put their health information needs into that Google search box. And one of the things I noticed was people were, over the years, no longer just looking for static information on web pages, but they were looking for each other. That caused me to leave Google and start a company called Smart Patients with some collaborators that was focused just on building online communities for patients and families affected by severe illness and looking for support from others who had been there. Fast forward another few years, and I got an opportunity to do that same work, but at a scale of a platform that has more than 2 billion people on it. So groups on Facebook are being used by parents of kids with rare diseases who have never met anyone else who has gone through the same thing, by nurses who are building successful national and global advocacy campaigns for the causes that they care most about, and by surgeons who are teaching each other on Facebook how to improve their surgical techniques on a weekly basis when they would otherwise only be meeting for an annual in-person conference. But this platform was designed in an era before we understood how it was going to be used. And so retrofitting it for the context of health is really hard work. And we're beginning to do that work. For example, just a few months ago, in health support groups, we launched a new feature which allows you as a member of a group to post without your name associated with your post, perhaps because you're asking about something embarrassing or that you feel that is especially private to you. And you can post, ask the admin of the group to review it, for example, to make sure you're not using anonymity to allow you to do something like bully someone. And then that post can be shared with the group, and hopefully you can get what you need with the privacy that you'd like it. And we're now working hard to figure out how to offer people more choices with respect to their privacy in Facebook health support groups. So stay tuned there, and we have a lot of work to do. And the last story that I'd like to tell you is from our Data for Good team. This is a team, actually I'm curious, how many of you have heard of Facebook's Data for Good efforts? Cool, that's why I'm here. That team looks to understand what data sets Facebook has access to that can be used to support disaster relief efforts while protecting people's privacy. As an example, you're looking now at a map of Puerto Rico, and this is prior to the recent big earthquake. And this shows the baseline amount of 4G activity. The redder areas tend to be more urban, and that's also where the most intense activity is. The reason that we're able to build this map is that we can measure the connectivity between people's phones and Facebook's data centers. Now, after the earthquake, that map looked like this. So a lot less red, especially in the southwest, where the epicenter of the earthquake was. I'll go back and forth again just to let you appreciate the visual. And we work with an organization called NetHope to supply them with this information. And they, in collaboration with the Red Cross, can then prioritize where to invest rebuilding infrastructure that's needed for telecommunications for humanitarian workers, as well as people who are trying to get in touch with their loved ones. So the opportunity here is tremendous. The responsibility, I think, equally great. We have unique challenges in leveraging the technologies that we've built, usually for a different purpose, in the service of of public health. Fortunately, I think many of us now understand that the opportunity is worth the work, and I look forward to learning more from you and hopefully collaborating with many of you in the months and years to come. Thank you.